Have you tried stretches, massage, injections, chiropractors, pain meds, and your back still hurts? You're not alone, and it's not your fault. Here's the truth no one tells you. Most back pain treatments don't work long term because they're only treating the symptoms and not the source of the problem. I see this every day in my clinic. Someone comes in after months and sometimes years of having pain. They've been told they have arthritis, a disc bulge, or their core is weak. They've iced, they've rested, they've stretched, maybe they've tried surgery, and they still can't sleep, sit, or exercise without pain. So why isn't anything working? Because the real cause of your back pain is rarely where the pain is showing up. And if you don't fix the root movement problem, nothing changes, no matter how many treatments you do. Today I'm going to break down the top reasons back pain treatments fail, the mistake almost everyone makes, including some healthcare providers, and what actually works to get rid of the pain and keep it gone. If you are someone that is frustrated, then this video may completely change how you think about back pain. Let's get into it. So we're going to get into 6 mistakes that people make, and so I'm also going to be drawing some things out so that you can understand kind of what's going on. So the first mistake is when you go and you see, especially with physical therapy, they just throw random exercises at you. It's like, oh, wow, you have pain down the leg? Well, let's go and do nerve glides. Well, you don't want to do nerve glides until you understand like what's going on with the nerve. Or let's just do some core strengthening. That's another mistake that's often said, like, oh, if you have back pain, it's because your core is not strong. Well, there's steps before that. So people miss the steps. There's no process of eliminating things based on baselines at most places, which is very different than what we do, where we're taking baselines and understanding. So first one, again, throwing random exercises, no patterns or things. Next one is core strengthening, that's going to fix the back pain, and that's the wrong step. We have to get to that later in the process. And so the third one, mistake that people make is soft tissue, is that, oh, it's your soft tissue's tight, so let's just release the soft tissue and that's going to help. The tissue is usually a symptom of something else that's going on, something that's not moving. And so we always say you've got to look at mobility before we can even get into stability. And so I'm going to kind of draw out the back and what it looks like and what I mean. And so when we look at this, we draw this all the time. Like if that's the bone, there's the disc, that's the bone, there's the disc. We have nerves that come off to the side. And so I'm going to draw this disc looking straight down. So when people have issues within their disc, this is how I draw it out. So when we go and we look at it, and we're looking at it looking straight down, it kind of looks like a P. And so that's the front part. There's the back. That's the left, and that's the right. And so we're looking straight down. There's where the nerves are that come off to the side and through here. These nerves come down and they kind of look like this. So you can also get nerve pinching out in here because the nerve can come down through here. So just because you get pain down the leg that is nerve pain, we've got to differentiate between, is there an issue here or is there an issue here? And our evaluation process lets us know on where it is. Now, I also gave you the idea of like, you don't want to be doing nerve glides with someone that has nerve pain down the leg, because you need to know, is the nerve scarred or is the nerve being pressed up against with a disc? So if it's being pressed up against with a disc like this, and that's hitting the nerve, that's giving you nerve pain, you don't want to do nerve glides on that because you're not fixing the problem. Nerve glides are when things have scarred down so that you can start like slowly improving the flexibility to go through. But if you have a disc that's pushing up against it, that's not a scarring thing. We've got to take the disc and move the disc off that area so that you take the pressure off those nerves. And we totally can do that because if everything is intact in that nerve, in the disc, it's like, think of a jelly donut, you have material that's on the inside, and if we push on one side, you can move the material away. You push on the other side, you can move it away the other way. As long as everything is intact, you can use movements, correct movements, to push things away from nerves or to help with herniated discs. We see it all the time. And so here's where the spinal cord would be, and there's a thick ligament that's in between the spinal cord, so you don't want anything pushing into that. But that's basically the disc. And so typically we want to ask, again, getting a good history is another reason why going to other places fail, because they're not going to they're not going to dive into a lot of your history and understand that. I mean, that's like 20, 30 minutes of our whole thing of just trying to figure out how the body kind of responds. But if you start having issues where the material's kind of stuck in through here, because of things that you do, like bending type things. So if we're bending up here, like bending forward, you can see it can push things back and through there. And if you do it enough over and over and over again without offsetting some of that, you end up getting issues down in here, and you start damaging the annulus that is around the disc, and that produces pain. Or you can create a herniated disc here to press up on the nerve, and that creates pain. And so when you have stuff like this, you have to fix this, because core strengthening is not going to fix this. I always like to use if I pull my finger back, and that's the reason why I'm having issues, because I'm pulling my finger back. If I come out of that, it doesn't matter how much core strength and that I have in that area. If I keep on pulling it back, the joint's not going to like it. It doesn't matter how much soft tissue I do. If I keep on pulling the thing back, it's not going to like it. We've got to address what's going on within that joint. And so that's kind of how we address it. So if there are issues through here and it's in the back, then we're wanting to put pressure through here and go in the opposite direction. That's where extension comes into play. And everyone's like, oh, if you do extension, it's the, that's the only direction that you go in. No, there's so many other directions. You can have issues out here. You can have issues here, up here. You can even have herniations that are in the front. Only happens about 2% of the time, but it does happen. And so all of these areas are different directions that we have to go into in order to hit this to kind of move the material away. But that's kind of the disc, and that's kind of like what we do with our evaluation, because if we can get this disc and everything to move where it's supposed to be moving, because you can, as soon as you move the material away from here, you can see like I can't go back because there's material that's in the way. As we do things to help push this away, then all of a sudden your extension range of motion gets better. All of a sudden you're going to feel more comfortable bending forward. Maybe you can actually side glide when we look at the motion, because if you're locked up on this side, we're locked up going backwards, or we're locked up going forwards, or we're trying to figure out, okay, why is that? What's going on? We use those baselines, do a motion, and then retest them, and it gives us information to know kind of what's going on. But that's how we do our evaluation process. So if you don't fix this, then it doesn't matter. You can do all the strengthening, and you can do all the soft tissue and nerve glides and all the things that you want to do. But if we don't fix this, then you're not going to fix anything. When you have issues within the disc too, often it refers right into that hip. So you've got to figure out the hip tightness that you're getting. Is it really coming from the back, or is there really something going on into the hip? So that's how we address all this stuff. Now, that's just one aspect of the back. There's other things that can create back issues that we don't look into. So if you don't have a systemized process of like, okay, we've just ruled this out, now we're gonna go over here. So there's other areas like the thoracic spine. When we have our ribs, as I kind of go, so we have our ribs on both sides and through here, and the muscles that go, and here's the pelvis is right here. We have our muscles that come in through here and attach all in through here. And so on both sides, and so they come down and they attach at each level and through there. If something is not moving up here, then these muscles will tense up and protect. And so because they're protecting up here, you may feel it in your back and not even realizing that there's tightness up there. And that's another thing that we have to look at. You can have your hip muscles, the hip joints in through here. So if your hips don't move, that's another area that we look into. So if we've already ruled out the back and we've ruled out the thoracic spine, we're going to go into our hip, because you can see If you can move through here in the hip joint, great. If it doesn't move, it's going to take the back. And so we've got to address the hip joint. That also can create back pain. And so in other areas in the front, the psoas, you can have tightness through here for whatever reason that can create some back pain. You can have your muscles, there's your hip muscles. There can be issues within your hip muscles that become more fibrotic. I've had that happen because I had a bad knee on my right knee and my left hip took everything over. Once when I solved my knee and got everything feeling really good with Shockwave, well, guess what? My hip started bothering me. Well, I had to go and do Shockwave on my hip, which then helped with my back. And so they're all connected. So it's not just, oh, it's so easy, just go and do this. There's a lot of components to it that we have to address. Now, so another thing is the lifestyle. People don't address your lifestyle. So let's go back to the finger. If the finger is what's causing the pain and we do everything to fix the joint, but we go back into pulling our finger back, it's not gonna last very long. It's gonna come back again. And so we've got to go into like, what are you doing? Sleeping is a big one. So we had a patient even recently, and I was like, do you hurt when you sleep? Yes. I'm like, okay, let me guess. You sleep in a fetal position. How did you know? We've got to get you out of doing that. And so we've got to address how to sleep and try to maintain better posture in your sleeping. Otherwise, you're just slowing the process down. If you have a sitting job and sitting is part of the problem, we've got to address that. If you want to go back to working out, we've got to come up with a game plan on how you can get there safely. And if you're doing things like, okay, let's say I have a back issue or a hip issue and you're cycling all the time, well, you're always putting it in a flex position. We've got to take it in the opposite direction in order to open it up. And so these are all things that we look at, and they're all mistakes people make because they think that back pain is so easy, and it's not. Like there's a process there's a madness to our process that we do to figuring out what is going on. And so the last piece, the last mistake people make is not getting to someone that really understands the spine. I mean, go and interview them and ask them, you know, how, like start asking questions on, have you ever treated someone with the spine? How many cases, you know, do you solve them? How many do you send to having surgery? Like, what is your philosophy on solving your back pain? Those kind of things. And if you're hearing like, yep, we do, you know, flexibility of the back and we do core strengthening, if you hear those things, run, because that is not what you need. And so if you can get to someone that understands this, you are going to be able to get back to your life so much faster. We have someone literally that came in and she did everything for 2 months, different PTs, trying to figure out what it was with her herniated disc. And no one ever gave her ideas of, okay, this is what you need to do. This is why you need to do it. You need to avoid this, this, and this. It's going to take, you know, give it 2 weeks because it's going to be a slow process, and then we should be able to speed it up. All these things happened. But she got no results in 2 months going to other places. And in 2 weeks, she's already noticing, oh, I know how to manage this and take care of this. Great. I know how to, now I know how to progress it. I know what's good. I know what's bad. I know when I've done too much. She has a whole understanding of all of these things to really help her avoid the surgery, which she's going to be able to do, which is amazing because she had a huge herniation. So again, you know, these are all different types of mistakes, and this is why people don't solve your back pain, because it's not just as easy as, oh, is it a herniated disc? You could have a herniated disc, but it's not even coming from that. Because, you know, a lot of people as we age get herniated discs and they have no pain. They've done so much research on that. It's absolute crazy. They have research where they took people and they did imaging of them, people that had back pain, people that didn't have back pain, and they went and said, okay, doctors, go and tell us who has back pain and who doesn't. And they were all over the place. They couldn't figure it out. So just because you get imaging on things doesn't necessarily mean that the herniated disc is what's going on. It's just a piece of what we look at. We've got to look at all these other areas as well, and that's what makes our evaluation process very unique. Here's the truth. Back pain does not mean your life is over. You just need the right information and the right plan. If you want help figuring out the movements for your back pain that you actually need, or you're tired of being told just to rest, send me a message or comment back below, and I'll send you our free low back pain guide. And if you found this helpful, hit the like button, subscribe, and share this with someone who's scared because they have not found a solution to their back pain. They need to hear this message. You can live a full, active life even if you have had back pain for years.